Good morning, everyone. Thank you for joining us. Today, we're announcing an additional step in our work to make Louisville a safer, stronger, and healthier city. This is a priority for Deputy Mayor David James, for myself, for our entire administration. And I'm proud to say that we are moving in the right direction. Homicides are down. Non-fatal shootings are down. But let me be clear. While these declines are encouraging, they are nothing to celebrate. There is much more work to be done. Work we are committed to seeing through with urgency, care, and action. And one of these efforts is our Crisis Call Diversion Program. Some folks refer to it as the Deflection Program. It's the same program. In 2022, Metro Council approved the launch of what was then a pilot program, which is a partnership with 7 counties services. I've been a huge supporter of this since I've been a candidate for mayor. I know that Councilman Ben Reno Weber, who's here with us today, has been a strong supporter of this. Other cities have implemented similar programs with great results, and we are looking to meet and exceed those results right here in Louisville. This program allows social workers to respond to certain 911 calls instead of the police. Through a series of questions based on the criteria of the program, MetroSafe call takers identify appropriate situations and then transfer the calls to the crisis triage workers in the behavioral health hub within MetroSafe right here where we are today. These individuals de-escalate the situation. They provide emotional support, create a safety plan, and problem solve for the person in need. People receive the direct care they need for their crisis, while LMPD has more hours that are free to focus on preventing and responding to violent crime. This has been an incredibly important and successful program already in its short time in existence. So successful, in fact, that one of the first things I did early in my first term as mayor in March of 2003, we expanded the pilot program to cover all LMPD divisions across the entire city. And I'm proud to report that in 2023 alone, this team responded to over 1,000 calls. That equates to over 2,000 hours of LMPD police officer time that was freed up for them to focus on preventing violent crime. The program currently operates from 10 a.m. to 10 p.m. 7 days a week. But today, we're gathered here today. We are excited to announce that those hours are expanding. Now, the Crisis Call Diversion Program will also operate between 10 p.m. and 2 a.m. every day. With this change, even more people across Louisville will be able to benefit from these services, and our police officers will have more hours available, more of their essential time that can be focused on preventing and responding to violent crime. We are going to keep moving with urgency to expand important services like this. Our goal over time is to make this a 24-hour program. We are also looking to expand into other cities that have their own police departments like J-Town and Anchorage over time as well. Because we know that all of these steps, the steps that we have taken and the steps we will continue to take, are making a difference. So now I'd like to introduce Nicole Wiseman, who's the unit manager for deflection with 7 county services, who's our great partner in this program, to tell you a little bit more about what they're doing. Nicole?
Morning. 7 County Services is delighted to continue the expansion of the deflection program. Deflection has grown from serving a single LMPD division to all 8 LMPD divisions, and from service hours from 2 p.m. to 10 a.m. to now 10 a.m. to 2 a.m. starting this Sunday. The lessons we've learned and feedback we've received are invaluable and shape how we will continue to mindfully and intentionally move forward. 7 County Services has been serving this region for nearly 50 years. Though the services are not necessarily new to our community, the entry point is. Never before have folks experiencing a mental health crisis been able to call 911 and be directly connected to a behavioral health provider right in the 911 call center. The goals of deflection are, and continue to be, to decrease LMPD runs on behavioral health issues and apply a more appropriate resource, to provide immediate and appropriate professional response to behavioral health crises, thus allowing all LMPD resources to be used more efficiently and effectively. Most importantly, and ideally, this response is decreasing the number of citizens being incarcerated or hospitalized who present with behavioral health issues. Though we've talked a little bit about numbers, I want to get into the weeds a little bit about the day-to-day and how to actually utilize deflection. So when someone contacts 911 and they're experiencing a behavioral health emergency, they can request to speak with deflection, or that option may be suggested to them. Once the 911 call taker determines that that person hasn't already taken steps to harm themselves, isn't actively threatening with a weapon, and there isn't any other violence that's taking place on site, it can be transferred over to our crisis triage workers that are sitting in the 911 call center alongside 911 call takers and dispatchers. Our CTWs provide de-escalation and offer resources, including our mobile crisis response team, who can come out and meet that person where they are. Our mobile crisis response team will further the de-escalation, problem solve, and offer resources. One of the resources that they offer is transportation to anywhere within the county. If they need to go to the hospital, our team can take them there, though we're always trying to work toward the lowest level of care appropriate for that person. That could look like another community resource or even a natural support like a family member or friend if they could help keep that person safe and stable. We also have a case manager that follows up after their acute crisis to see if they got what they needed while they were in crisis and helps connect them to ongoing resources to mitigate and potentially prevent the next crisis. Our team meets the client where they are, literally and figuratively. Hence why one of the main components of the program is that it is voluntary. Decisions are made with the person in crisis and not for the person in crisis. Additionally, each intervention should be the least invasive and least restrictive option. If a person just needs to talk with someone, they can do that, and the interaction might end with a CTW. We see it as a success if the person is de-escalated and feels safe enough that the team doesn't have to come out, or if the team goes out and the person is able to safely remain in their home and not need transport. We also see that as a success. With each interaction, we leave them with a plan and next steps, including who they can call back to if something else happens again. We frequently utilize our partners at 988 or in communication with them daily. The folks before me have also shared numbers, and though numbers are important, the true impact is captured in some of the quotes we've heard from some of our clients in crisis during their follow-up. I'm much better and have made so much progress since then. There's been significant follow-up and follow-through, help and assistance. They calmed me down, and simply, they helped. We do not and cannot do this work alone. Our team works closely with our other providers within 7 county services, as well as other community programs to ensure that folks in crisis receive the best care and support possible. We are continually looking at additional ways to expand our program to ensure that folks experiencing a behavioral health crisis get the right response at the right time by the right responder. We're continually expanding our resource list, so if there are providers that would like to be added, please reach out. We still have plenty of work to do. Though we have 34 staff on the deflection team, many are actually part-time or PRN, so we're still in need of additional staff to continue our expansion so that we are eventually able to provide 24/7 coverage to the entire county. We have a fantastic and diverse team. They come to this work with a variety of lived and professional experience in mental health, substance use, and houselessness. If you would like to join our growing team, here's my plug, please go to 7counties.org, click careers, and search deflection to see what positions we have available. Thank you.
Thank you so much, Nicole, and you are so right. We need so many more mental health professionals across our entire city. This is one of our many efforts that our administration is looking to support to provide more mental health care services to individuals in need. And just as we need more police officers, we also need more mental health professionals. So thank you for putting that out there, and I hope people will take you up on that effort. Another partner in all of this is LMPD. LMPD has been a strong supporter of the deflection program since the beginning and continues to work with all of the organizations and people involved to help make it a success. So today we're joined by LMPD Deputy Chief Steve Healy, who will share a few words about LMPD's involvement and support.
Thank you, Mayor. Thank you, everyone, for attending today. As the Mayor said, we are very excited for the expansion in hours. We're very thankful for this program because it takes a lot of man hours away from LMPD in responding to these situations, where we can continue to focus on reduction in violent crime in our city and keeping people safer. It is so important that we can work with others and work efficiently together to create and figure out problems and solve these problems, working in a cohesive manner, not just for the agencies that are involved, but for the citizens that are involved, and getting them the best help and care possible. So once again, LMPD is fully engaged and thankful for this program and the ability to free up our officers to, like I said, focus on violent crime and create this a much safer city. Thank you.
Thank you. Thank you so much, Deputy Chief Healy. And finally, we have one of our big supporters from Metro Council. Metro Council has been a strong supporter of this program as well since it was launched as a pilot program and has continued to provide strong support for the expansion of this program, which was funded in last year's budget that was unanimously approved by Metro Council. And one person on Metro Council who has been leading the charge with advocacy and support for this program and for other programs that continue to expand our outreach to provide more and better mental health care services to individuals in need across our entire city is Councilman Ben Reno Weber. Councilman?
Thank you, Mr. Mayor. Really appreciate it. And I just want to say thank you so much to the phenomenal team. One of the things they have not said is that we are being nationally recognized for this model. Other cities are coming in and studying what we are doing as we went and studied other cities at the beginning of this. So I think this is just such a phenomenal example of us doing exactly what we should do as a city. Center the human experience of the people that live here, wrap around them with the services they need to reach their full potential to de-escalate from crisis. And what I love about this program is that we're really going at all of the building blocks that we need. You need somebody to call. So thank you to the 911 team, to Director Myman, for making that such a high quality experience that people know that they can access. We need someone to respond. And I think that's where 7 counties is really in growing this team, been able to give that. And then they need someplace to go. And I think that's really the next steps for us, is being sure that we have those spaces in nonprofits or in city-run facilities that are ideally not the jail and not the ERs. This is a fiscally responsible and socially caring program, and I'm so proud to be able to be a part of it. So thank you so much for all of the efforts that we have been able to do so far, and I look forward to continued expansion.
Thank you so much, Councilman. So there you have it, a little bit about the program. Nicole shared some of the great success stories that really is what's most important. This is about serving people in our community who are in a time of crisis, who are in need, and how can we best serve them. And through this deflection program, we have improved our service to others throughout the city. We'll continue to expand this program. We'll continue to provide this type of help to others, and we'll continue to focus on making Louisville a safer, a stronger, and a healthier city. We will do that with urgency and with action. Thank you all very much, and I think we're happy to take any questions that the media might have this morning.
I assume with the expanded hours, it's going to require more personnel from law enforcement, city, money from 7 counties. Is that going to expand? How is that?
Yeah, so others might want to chime in, but in the last budget that I mentioned that Councilman Reno Weber and others supported, we provided expansion of this service in the last budget. And so there is ample funding in the current year budget to cover this expansion of hours as it is right now. I believe the total team from 7 counties right now stands at about 35 individuals who are working, some part-time, some full-time, some are in the call center, some are going out to make those calls directly. But we have the funds in this current year budget, and then of course, Councilman Reno Weber-I and his other colleagues will focus on what is needed for next year as well to continue expanding the program. But I don't think funding will be the issue. As you heard from Nicole earlier, getting more individuals to be qualified mental health professionals that can provide these services in the right way. We need more people to help. Our city will stand there to fund that.
This might be a question for Nicole. You mentioned partnering with 988. How is this different from that prevention line? Is that correct?
Sure. So 7 counties also operates the 988 line locally. Our Crisis and Information Center that's been around for even longer than 7 counties has been operating and providing those kinds of services once it's switched over to 988. The calls for deflection do come directly through 911 or that non-emergency number, the 574-7111. But for instance, someone might call 988 and they would prefer an in-person response. Since they are already 7 counties employees, we are touching base via Teams and saying, hey, this might be something for you all, but then helping them go ahead and do a warm transfer from 988 to the 911 call center to get to our CTWs so that they can actually have an in-person response.
Can you speak more to the numbers? You said there's 1,000 calls that were taken since this began.
The 1,000 numbers that I referenced, there was over 1,000 calls just in calendar year 2023 with the limited hours that and the limited service area at the beginning of the year that MetroSafe took under this pilot program. Those numbers are certain to grow in 2024 with the expansion citywide and with the expanded hours.
What do you think those numbers would be? Did you set a goal, or do you know what they'll be?
Our team is here to respond to as many as necessary, but I don't know if we have any kind of predictions as to what the numbers will be. But again, we are staffed to support it now from the hours of 10 a.m. to 2 a.m., 7 days a week, starting this Sunday.
And that relates to how many LMPD hours, and how is that determined?
We translate that into over 2,000 hours of police officers' times that they would have spent responding to those calls that prior to this program would have, under the protocol, would have caused the LMPD officer to respond to the location of the call. So either by the 7 counties team that was able to de-escalate and provide services just on the phone, or where they sent out individuals to that home without an LMPD officer. That's how that was calculated.
Do we have any data on how helping to solve the mental health with people that are going through a crisis, how that has translated into maybe reduced numbers of violence?
Others can chime in as well, but what I will say is that reducing violent crime in our city is a multi-pronged, citywide effort where we need partners from every walk of life focused on preventing violent crime. We need help from our, not just Metro Council, but our state legislature, our federal government with respect to laws relating to guns in our city. We, of course, need the police to be there to help prevent and respond to violent crime as well. All of these areas are important. Programs like group violence intervention, expanded hours in our community centers so that young people have things to do and more opportunities to get exposed to the world, and our education system is so important. All of this, including enhancing mental health services, I believe has contributed to seeing our homicide numbers come down, our non-fatal shooting numbers come down. But again, there's nothing to celebrate. We must continue to work even harder to bring those numbers down even more. One violent crime, one homicide is one too many.
How many staff will it take to go 24/7?
I believe that would be in the press release that's coming out. At this point, we have enough to do 16 hours. So what we have done is look at the call volume. So hence why we started from that 2 to 10 p.m. Time frame, and then we've continued to expand out from that. Since the only missing piece is 2 a.m. to 10 a.m. at this point, we know that there will be less calls during that time period than previously, but I don't know if I have a specific number right now.
Is staffing the only roadblock for going 24/7?
I think that's probably our biggest concern right now, yes, making sure that we've got enough folks to be able to respond safely.
How many cities have this program, and are they comparable in size to Louisville?
There are, prior to the launch of this program, there are, we looked at programs across the country. There was 16 months or so of planning before it started, and the numbers have just exploded since then. It seems like there are many, many cities across the country that are having some type of program, whether it's an alternative response, a co-responder program, or something of the like. So it has definitely continued to grow.
Councilman Newcomb.
Go ahead.
Well, you can say what you were going to say, but I was also going to ask, you mentioned the next step would be to have more places for these people to go beyond just jail, beyond maybe some of the nonprofits that are doing it. What are those places, what do they look like, how can you and your colleagues and the council?
Yeah, so I absolutely, and that's actually connected to the other thing that I wanted to say is that there is also a statewide initiative being led by the Cabinet for Health and Family Services to also provide crisis response across the state. So I know that we've been in conversations with them, and one of the things that we'll look to do is like make sure that those models are at least talking to each other. We should be learning from them; they should be learning from us. And then ideally, I would be remiss if I didn't say if we do this in a way that it was makes it possible, we could bill Medicaid for some of these services. So in terms of what other opportunities for people to take, we need to have a respite space for people to be able to go just for that sort of initial moment of detoxing from that trauma. And again, the state is now offering to pay for those services starting in July. So there's a real opportunity for us to say, okay, great, how do we leverage those state resources to create that kind of space? Partner with the nonprofits. Deputy Mayor George, if she would here, would say, we do have additional capacity within our existing nonprofits if we can help them to activate it. They're often struggling with the same things of staffing and funding. And so we need to be able to look at that. And then longer term, we really need to be looking at what does it look like for us to be providing meaningful, supportive housing resources. And we have some great models in our city. I look at what's going on with the Arthur Street Hotel and their track record, and we need to be able to offer enough of those services to people so that we can help them to be not dealing with the issues of chronic homelessness that they are, which are not good for them and not good for us as a community.
So there you have it. If you're looking to get involved and contribute to our city, join us, be a part of the solution. Apply to 7 counties, apply to LMPD, but join those of us who are working to make our city a safer, a stronger, and a healthier community. Thank you all very much.